Hello, everyone, and welcome to the 7th lecture of the lecture series. This is Public Health. We will slowly but surely get going. This is the lecture series. This is Public Health, brought to you by the Swiss School of Public Health and by ETH. Thank you so much for joining us. If you don't know me already, then my name is Emily Reeves, and I'm the moderator for this lecture series. And I formerly was managing the project of the SSPH Plus at Expo Dubai project. And some of you will have learned already much about the Expo project in Dubai through the lecture series, as we've been able to see and take a look at some of the material that was used at the Expo and the outcomes of the Expo, like the Expo lecture series and also the Health for Sustainable Development Goals quiz. So if you haven't done so already, then I encourage you to scan the QR code, which you see in front of you, and that will take you directly to the SSPH Plus for Sustainable Health quiz. So I encourage you to take a look at that and see the kinds of things that your community, the SSPH Plus community, has been contributing towards that from lots of different backgrounds and perspectives. As always, I also link up there, highlighted in yellow, a link to where support services can be found if you are a student of ETH, but these similar kind of support services can be found across almost all universities. So should the current situation that we're living in at the moment be affecting you or those that you know personally, then please don't hesitate to take a look at that link and make the most of the resources that are available to you. But otherwise, if you have any questions or any feedback or would like any help with anything in that regard, then please don't hesitate to get in touch also with me. My email is given there in this blue circle. Now, today we have an expert who will be bringing to us information, lots of interesting insights and information about misinformation and infodemic management. So in light of that, I thought that the way that we could start today's session is just by very, very quickly asking or opening the floor up to whether or not you believe that you've come across any kind of misinformation, disinformation. And so just for a minute here, I thought that we could open the chat up. That means that if you have a piece of misinformation that you can think of, please take this moment now to write it in the chat. Perhaps Professor Sara Rubinelli will actually address this maybe later, some of these points. So I open the chat up now. Please do write some of these pieces of misinformation that you've seen in this chat. Or otherwise, if you like to, you can also open up your microphone and share pieces of information that you have heard. And we're just going to do that for the next minute. So anyone who has any questions or pieces of misinformation that they can think of, please write them into the chat. Otherwise, you can also mute yourself. What I can say from my side is some pieces of misinformation that I have heard. Partly is, for example, with respect to how COVID is spread. So some people believe that COVID can be spread only through hand touching or through shoes or through coats. I mean, there's all these things, these pieces of information that we hear, and yeah, so this adds to a lot of confusion, and I'm sure that this kind of information is very mild in comparison to the other kinds of misinformation that can come up with respect to COVID. It seems that the chat is very quiet and nobody seems to have heard any misinformation. I'm astonished. Is it perhaps that I'm just perhaps touching on too much of a labored subject, a subject that people don't want to think about? I don't know. So since nobody is, seems that nobody has, here we go, now it's coming. So that the virus was or is fake, yes. About the use and the care of the masks, yeah, of course. Lots of misinformation about that, certainly, and whether the masks are important or not. Whether it's better to get natural immunity rather than immunity through the vaccines. Very good question, especially as we're talking about boosters and other countries having different approaches to whether people or not go for the boosters. Vaccination changing your DNA, pregnancy and COVID. Links to the 5G networks. Okay. Initial belief about drugs working. Oh, ivermectin or dangerous. Okay. Like Brufen and so on. Yeah. So slowly, we're starting to see that there is Bill Gates behind it all. Thanks. Okay. Yeah, I think that the list could go on, and that's why I was rather surprised it took some time to get some initial feedback in the chat there. But thank you to those who have contributed to the chat. And perhaps now I could introduce somebody who will be able to hopefully answer some of these questions. I would actually like to close this chat down at the moment. As you've seen, just very briefly there, just for that brief period of time, we were able to already come up with a couple of pieces of information or misinformation that we have heard circulating. So it's really a pleasure that we have with us an expert in the field, Professor Sara Rubinelli from the Department of Health and Medicine. She's a professor of health sciences with a focus in health communication, and she's based at the University of Lucerne. And today she'll be talking to us about exactly this, so institutional communication during pandemic threats, insights into the WHO competency framework for infodemic management. It's an honor to have you here with us, and we look very much forward to hearing what you have to say and to hopefully answering some of the questions that we have flying around. Thank you, Professor Rubinelli. I hand things over to you.
So thank you very much for this introduction, also the interesting exercise, because it gives a lot of input for what I will say. And thank you very much for all of you. Unfortunately, I cannot see you, but I know you're there. And so the chat is a very good option that we can use. Now I share my screen. Yes, this one. Because, yes, I think today, I mean, one of the reasons probably why you had difficulties in choosing what disinformation to put on the chat is probably because there was so much that it's really difficult to say which aspect to consider. And one of you wrote the intentional versus non-intentional. When I spread information knowing that it's fake, or when I share information thinking it's a good one, makes a huge difference in the field. But I mean, what I want to present today, from the very beginning of the pandemic, indeed from March 2020, I started to work with the World Health Organization on the concept of infodemic. I will tell you in a minute, although you have heard this word already before, infodemic, which is the spread of too much information and the need to manage for institutions and organizations. And for WHO, I have developed the competency framework for infodemic management, but basically, as I will show you, brings into perspective all the competencies that institutions and organizations need to manage this information in a way that basically avoid losing the trust of the public. Because here is the key point of all of this is that if disinformation, if bad information is persuasive and is against institution and organization, then there is a problem in the relationship, in the compliance. So an infodemic by definition is indeed too much information, including false or misleading information. It causes confusion. Too much information causes confusion and risk-taking behavior that can harm health. And of course, with growing digitization, information can spread even more rapidly. And this is why what we are facing now, we face it with COVID, and to a large extent, we are now facing a lot of disinformation about the war, and with some of the same dynamics in both contexts, because there is no way of going back to a society which does not have infodemic. Is more or less the expression of this having so many communication channels. But here we come to an important clarification done by Wardle, but in 2020, but very much in the literature. The distinction between misinformation, disinformation, and malinformation. Misinformation is information that is false, but the person who is disseminating believes that is true. How many videos were shared on WhatsApp, for instance, where there was not the intention of spreading fake news, because many people disseminate videos thinking that it was good content. Disinformation is different, because the information is false, but the person who is disseminating it knows it's false. But nevertheless, he does it for many different reasons, interest, profit, whatever. But there are many different reasons. And then there is malinformation. That is information that is based on reality, but used to inflict harm on a person, an organization, or on a country. These are the typology. Now, of course, misinformation or disinformation, because then you find the old terms used in the literature, and sometimes not without precision, but when they say misinformation here, they intend also disinformation, is not only an issue in the COVID context. Because like here, the US Surgeon General Advisory on Building a Health Information Environment acknowledge that infodemic is a major problem there. Is a problem basically in all healthcare setting where there can be fake news about evidence, about treatment, about outcomes, which basically is virtually any healthcare setting. An area where we have a lot of disinformation is oncology, for example, but many other. And leaving aside also the context of chronic health condition, where there are so many examples of disinformation. And here another area by WHO European Office, misinformation and non-communicable diseases, because there, misinformation, which is the unintentional spreading of false information, as well as disinformation, the created intention of spreading false information, have proven to be very dangerous to public health. As more and more individuals obtain their information from digital sources, and then it becomes extremely difficult for users to determine the validity of messages. As we shall see, individuals need guidance. They need institutional guidance. Infodemic management has been conceptualized very nicely by Heisenbach in this article from 2020, basically showing the cake model and showing what are four main pillars. So four main aspects where institutions and organizations need to pay attention in order to manage infodemics. As you can see, infodemics comes from this interaction between science, policy, healthcare practice, news media, social media. They all are interconnected within a dimension of knowledge translation interpretation that unfortunately is not always ideal. And there are four main pillars to do. First pillar is accurate knowledge translation. Knowledge should be translated into actionable behavior change messages presented in ways that are understood by and accessible to all individuals. This is basic communication. We all know this. We need to send to society messages which are clearly. But unfortunately, knowledge translation is subject to political, commercial, and other influences that distort the scientific message. But then the influencing factor should be minimized. It would be very much important, for example, to identify claims, even political claims, when they are against evidence-based, because otherwise they go into the arena, and from the arena, as soon as they are on the media and on the social media, they get at the individual level. And the problem is that a lot of this mis and disinformation has a behavioral impact. People act upon these messages. The second pillar is fact-checking. Fact-checking, I mean, there are platforms. Probably in this COVID time, you have seen fact-checking platform that analyze fake news, and they say, for example, why this is a fake news. Thinking about one of the examples you put in the chat, the connection between COVID and 5G. And 5G, 5G, there is a lot of, I mean, there are a lot of evidence. There is a lot of evidence that this is not the case. There is a lack of evidence actually on this, but the topic is addressing platform that clearly explain why this is not the case. What the point is, this platform often do not have an institutional or organizational affiliation. And therefore, somehow they lack visibility. They are very good. I've seen many interesting platforms, but it's very unclear who is behind this platform. Sometimes people, individuals themselves, who decide to explain why something is fake. But of course, this should be an institutional, organized effort to do this in a systematic way. And just a month ago, I was reviewing a project in a UK country, exactly proposing to have an institutional platform for fact-checking to act at the national level. They need a lot of resources to doing this, but it's a very important control for the quality of the information. The third pillar is eHealth and science literacy, major topic, because the user carries a significant part of the responsibility to select and evaluate health information. For example, nothing stops a user from tapping into the vast array of unreviewed preprint published in preprint servers. And I show you an example. This is a repository, MedReads, the preprint server for health sciences. Here they publish preprint. But look at the message behind. Caution. Preprint are preliminary report of work that have not been certified by peer review. They should not be relied on to guide clinical practice or health-related behavior, or should not be reported in news media as established information. This is what it says. The problem of all of this is that to understand this, you need to understand a lot about the peer review process. Because what's happened during the COVID time, even before already happened, but is that preprint were used randomly, and to prove, for example, something that, as a matter of fact, it was not proven because the paper was not peer reviewed, the analysis was not correct, but nevertheless, people take this paper, who looks like a proper publication paper, and disseminate. Why? Because of the overall, there is the need of having a strong scientific literacy, leaving aside groups that intentionally use a preprint for the purpose of what they want to show to people. So, and they could not care less whether the preprint are peer reviewed or not, because they think people will not know, by the way, what is the peer review process. And the fourth pillar is Infoveillance, which requires generating metrics on information supply on the internet, including its quality, as well as information demand metrics such as search queries or questions posed on social media. What does it mean? Basically, institutions need to monitor what people say, think about that, the question they have, what worries them, which is a huge work because it means social listening, basically. And social listening requires a lot of skills, a lot of methodologies. But in 2022, we have all this methodology. We know that it's possible to screen the social media and to understand where is it that we need to give content to people. Otherwise, people will be lost, and even more, people will look for information where they can find it. And as I always say, very often, persuasive communication is disinformation. But it is convincing because a lot of this information is, I would say, manufactured in a very convincing way. So some history about WHO in all of this. As I say, I was very much with them in the beginning. So on February 15, as you know, Tedros Ghebreyesus word the word of the threat of an infodemic. It was the first time WHO said, look, this is not just a pandemic. This is an infodemic accompanying the pandemic. And in April 2022, the United Nations Communication Response Initiative, they start to think we need a task force to combat the spread of misinformation. So in May 2020, there was guidance note on addressing and countering COVID-related hate speech. And between June and October, and there is where our work started on a programmatic level, there was the Global Online Technical Conference to develop a public health research agenda for infodemic management. It was a huge endeavor. I think in the first conference, we were something like 7,000 people from all over the world. And then we grouped, and I took the leadership on the, together with the WHO and the US Center for Disease Control and Prevention, to publish the competency framework. And I basically did the research. I will show you what kind of research to understand what specific competencies are needed to manage infodemic from an institutional perspective. This is the competency framework. You find these on the website of WHO, but I also gave it to put on the website of this lecture series. So you find the framework there. What is a competency framework? Is a document by WHO they did in other fields, but basically it's a guide to orient and support the design, development, evaluation of the need of institutional workforce. And it specified the activity, what people need to do, what the employee of institution need to do, what tasks, what knowledge they require, and what skills they need. Between a task and a skill, there is knowledge and skill is a difference, because the knowledge is really the informational basis. So basically, what do they need to study? And the skill is the ability following up from a learning experience. What I did, I made a qualitative study with key participants, basically 26 key participants from the world. And here I have to say, this was working with WHO on this was ideal, because I could get into contact with people who are were active at the governmental level in the various nations. So we have people, 10 academics and 16 professionals in government or major health institutions worldwide, from Africa, Belgium, Canada, China, Finland, Italy, Malta, Pakistan, Sweden, Switzerland, Thailand, UK, and US. And the background of these people was informatics, health behavior change, health communication, economics, education, health literacy, and so on. So basically what I did, the first step was to conduct expert interviews where I asked what were the major barriers that they face and what are the most important dimension of infodemic management. And the first things was, it came out, it was a qualitative study with a thematic analysis. The first thing was the institutional capacity. So they all say, you know, we need resources for doing this. Institutional capacity required findings, human resources, and having a legal framework. Government have to partner and show awareness of the importance of infodemic management. This is the very basis. I mean, infodemic management is not something randomly addressed, but need to be really into the core and the major activity within organization. Then the ongoing education, because they also say an important thing, institution, I know that saying that institution educate the public is a top-down approach, but as a matter of fact, there is a sort of, call it empowerment, call it guiding, but the public need to be guided, especially when information becomes available, and especially when guideline changes. And here I had to say, with a bit of a critical notice, that institutions were not so good in explaining why recommendation changed over time. I was lucky to be in 2 countries during this COVID time, Italy and Switzerland, who adopted a very different approach to that. But I have to say, especially in Italy, it was a lot about people have to do A, B, C, D. It was very little about why. Evidence. Why before they say, yes, mask, no mask. Why they change it a lot of things, which it was absolutely normal because, I mean, it was a pandemic with an unknown virus. So uncertainty was key into the topic. The other thing is targeting communication, because that is the basic of health communication. We need to consider what form of communication people need, written, audio, visual, and so forth. Because, for example, everybody realized how much people love to watch this video on WhatsApp. That was a tool that reached millions of people got into this online world of watching videos. So then health institutions need to reflect on what to do. And here I have to say WHO made a major effort to be present on Facebook every second or third day, and to have a proper, to film the time that they had with the media when they were explaining things. So every 3 days, there was an hour where WHO was explaining the situation with the limitation of the language, because most of it was in English. And so, for example, from a target who does not speak English, that was problematic. Marginalized people, of course, it's an issue in public health, in every sector. It is also an issue on infodemic. Here, marginalized, we have also to think who are the people who do not receive the right information. Health literacy is an issue, but just know that health literacy is a strange issue, because sometimes when people have perceived themselves as too literate, they tend to have their own ideas about things, and when people have lower literacy, they tend to trust more the institution. I mean, this is not a rule, but I mean, in the context of infodemic, the way people process information is very different. And high versus low quality. Everybody in the study pointed out that freedom of speech, for sure, is important, but there should be some limitation. And here I'm not sure whether we get into this, because it's a point that I put into at the end of the slide. But last month I gave a talk about med influencers, which is those medical doctors who were very active on the mass media at all level and on the social at all level. And some of them, I can think of some Italian example here as well, were very extreme in what they were saying, and very often they were also not in line with the guideline. And so what it was pointed out here is that we need institution, organization need to develop protocol to actually rule the practice of employees and everything in this respect. Of course, freedom of speech, again, but we need to see what's about when someone intentionally spread disinformation. In partnership, there is no such a person who can have all the skills, which means infodemic management requires a team. It's not just one person, because it's not just one person that can do the whole job. So basically, WHO link infodemic to the phases of epidemiology. No? So sort of seeing surveillance in epidemiology, it was like social listening. The virus is a bit like the narrative containing mis and disinformation. The disease, the real problem here is the distrust toward the health institution, and then you have the intervention to sort of rebuild trust. Here you see exactly the 5 work stream in the epi curve of an infodemic response analogous to the epidemic response. So you have in epidemics, you have surveillance, the virus, the disease, the intervention, and you have the listening, the narrative, distrust, and intervention. Yes, Emily, I see 10 minutes, good. So when we go concretely into the infodemic management toolkit, the first thing is infodemic manager have to listen to target audiences and identify individual information gaps and needs and behaviors. This means they need to be skillful in utilizing research methods, social listening, social media monitoring, tools to collect, analyze, and evaluate data. But also the skill to identify target for intervention for behavior change. So there is not just knowledge of communication, but it's communication for behavior change. So within an ecological behaviors perspective, which is nowadays the most complete framework for behavior change. Second thing, infodemic management have to share accurate and appropriate information with the target audiences to increase awareness, promote health literacy, and strengthen behavior. And here, basically, the field of health communication has all theories, all models, all tools that can be used to do the so-called tailored health communication. So it is a matter of understanding how do I build a persuasive messages with all the tools that I have at disposal for the specific context of the community or the target audience that I want to address. Intervene, infodemic manager, design, implement, and evaluate intervention to promote resilience to misinformation. And here we have the whole field of social marketing, of health campaign, of multi-level intervention of public health. But the very important thing is that we need to evaluate information. We need to evaluate what we do. Health institutions need to know what communication is persuasive and what is not persuasive, which means doing basically research on that. And infodemic managers build resilience to misdisinformation. So they need skill to develop and utilize standard operating procedure to collect, analyze, and correct misinformation. And very important, to build and strengthen coordinated work with partner organization. This was something very difficult in the COVID time because many of these relationships were not in place before. And when there is an acute event, it's very difficult then to coordinate in a national level, for example. I had to say Switzerland being smaller was better. Country like Italy, bigger, there was really, really no coordination. And that impacted very much because people receive different information from different institutions, which was less than ideal because it created confusion over anxiety, which means overall strengthening institution capacity. Here, I have to say that now that the COVID pandemic seems to be bearable, I would like to see health institutions strengthening this capacity. First of all, because as I said before, infodemic is a problem in public health. And second, because management of infodemic, good communication, persuasive communication do not happen randomly. People need to work on that and they need to implement teams of people working on this. And these are overall the discipline, all the disciplines that are involved, from behavioral science, communication, data analysis, epidemiology, public health, evaluation science, implementation science, dissemination, and overall infodemic management. I mean, why overall do we need to do this? Because few dissenters in the scientific community who are louder than the silent majority, because I mean, we need to have an institutional response, because although a lot of people seems to talk during this pandemic time, but as a matter of fact, institutional, I would say, coherent view were very much challenged by a lot of aspects. There is widespread scientific illiteracy, which to some extent is normal because we do not expect that people know how research is carried on. On the other hand, you know, when people started to question vaccine and everything, there it was clear that they had no idea whatsoever on how a vaccine is created and how a vaccine is tested and how a vaccine needs to fulfill ethical standard. This somehow, I mean, we cannot expect that people build this knowledge by themselves. Institutions need to play a role in that. The other problem, presenting opposing view as having the same value. This is, I refer specifically to talk show, and here I have to say, being Italian, I can say this. In Italy, this was a major problem of having talk show, TV talk show with people with different, completely opposite views who basically were fighting on TV. And I always ask myself as a scholar of health communication, what is the purpose of this? Because then it creates a team like football. So there are people who like Milan, people who like Juventus, people who like Inter, and these were with different opinion leaders in the field. Overall, it was a chaos. And a lot of misinformators are better communicators. That's an important aspect. So critical thinking and trust are key. We need to reestablish trust in the institution, because again, when people trust, they follow better the recommendation. And we need to promote critical and scientific literacy to build resilience to disinformation. But here we really need to have an important institutional perspective. Now, I think I still have a couple of minutes. So what I do, I just jump, you will see my slide, but I just want to tell you that to complete this, I mean, my work with WHO is matched with this project that I'm doing for the Swiss National Science Foundation under the special call on coronavirus, where I study the standard for institutional health communication in Switzerland. And there, I'm now making the analysis together with my team of 50 interviews that we had with important people for communication, people in leading position for communication in Switzerland at the different levels. And there, what we are now analyzing is what are the strengths and institutional lacks in the context of WHO infodemic framework. So the idea is then to create a guiding document to advise institutions where to invest to strengthen their capacity for basically public communication in the context of a pandemic, but in general in the public health context. And here are some of the questions that we are asking. We ask now, we are in the process of analyzing, so hopefully I will soon be in the position of presenting some the result of this. Overall, I just want to close with this quote. We have all theories, model, and framework to manage infodemics, but now health institutions and organizations need to prepare because there is no way back. There is a time without infodemics. I don't think there will be. Low quality health information can kill, and this is the urgency, I lost, during the pandemic, I lost my uncle because of disinformation. So I know very well what this means. And the effective institutional communication requires preparation and thus resources. And overall, it is a main issue for public health. And this is why I was so keen to be able to present this today here, because I really want to make the claim that this is a major issue for public health. Thank you very much.
Thank you very much, Professor Rubinelli. Thank you for your interesting talk. I'm sure that there are just as many questions now as there were in the beginning, and there's so much to take in, and it's really very interesting to have had you talk about something which is so unbelievably relevant for all of us, and so many of us will have known disinformation or misinformation at some point or another, whether in our own life or whether in the life of someone close to us, as you also shared. Usually we do have student discussants who lead the discussion time. This week we don't have that, so in that case I will be leading the discussion, but I essentially with that I'm saying that I open up the floor to any questions now. We do have Q&A time, so we still have time for questions. And so I would like to invite everyone to unmute their microphone or to write directly in the chat any questions that you may have to Professor Rubinelli. And I take a look at the chat for you and I will read your questions out. Otherwise, just unmute your microphone.
Yes, I have a question.
Yeah.
So in the mostly in the end, you touched on that that people need to trust in these institutions a lot. So that is kind of the core. So in any sense, even if you have great messaging, if people don't trust the institution, they won't trust in the messaging. And so my question is, how do you rebuild that trust? Because I think that was one of the big ones that suffered really in the pandemic. I mean, and obviously much of this was overblown also in media, but I think there was some truth there. I mean, the World Health Organization in the beginning of the pandemic, I mean, even into the end of March 2020, issued statements that masks did not work for healthy people and that people shouldn't wear masks, and then pulled a full 180 and went in the other direction. So I think how a lot of these ideas that you brought forward require people to trust institutions, and I think how do we make them trustworthy in the first place?
Yes, thank you very much, because it's a major point. So first of all, trust is not something that you do from one day to the other, because trust is something that you need to build. And one of the things that really makes people to worry and to lose trust is the fact of changing view, or giving the impression that someone doesn't know what to do. I mean, this is a normal thing. If you go to an hairdresser and the hairdresser shows that he doesn't know what to do, then you don't trust. So the point is, preparing for keeping trust means, for example, having a clear strategy not to speak without having some evidence, or to speak when or to say why a certain view has changed. You need to guide people in the understanding, and this is, but you need to prepare how to do this. So I mean, in terms of a pandemic, one could imagine at some point a virus comes. How do we inform people about this? And there are a lot in the literature, there are a lot of models of risk communication. How do we communicate this? And all these models say, be careful, have a daily, but not excessive, but daily conversation to explain things in this way. Don't hide what you don't know. Don't pretend to be secure and sure about something that the day after you need to change. Guide people in understanding that when a virus is new, we do not have so much knowledge, but nevertheless, we can use knowledge from the past. We can then build more knowledge, but you need to really guide. So how to build trust? You need to talk. And one thing here I have to say, because this morning I lecture on health communication with my student, and I told them now that the COVID is no longer a big topic, because I mean, you hear something, but it's not so much. This is the time where institution and organization should say something to people, should explain things to people, and not stop talking. Because imagine, hopefully not, but if we need to go back to some restriction, it just would be a disaster. Because now people need to see, for example, that the reason why we sort of have a normality is thanks also to the efficacy of the vaccine. I mean, it's thanks to many people, but institutions need to keep communication about issues. And this is something that instead is critical. And so how to do this? Daily strategic communication and explaining. These are two key aspects.
Thank you very much for your answer. I have here another question, which is written in the chat. I will just read it out, and it says, thank you very much for your talk, and I'm very sorry for your loss. The question is how to approach teaching people the fluidity of science, and how there are a lot of specialists and not one scientist who knows it all. Can we learn perhaps from other projects like washing hands with soap or sex education?
Yes, this is absolutely, we can learn because we have area where in the beginning, for example, smoking, I just take this. Smoking, I always show when I do social marketing, I always show when there were adverts about my doctor smoked Camel. And then at some point, evidence was, they started to build evidence on the fact that smoking was bad, but you needed to enter into an area where smoking was cool. So the evidence were contrasting. So we have to learn on those things, and we can have example when there is a lot of divergency about views, but nevertheless, in the COVID pandemic, there were some agreement. There was disagreement on some issue, especially the lockdown, also because it was linked to some political thing. But in terms of certain social distancing, wearing masks, I mean, there was more. Now what's happened, again, countries are very different, because in Switzerland now there is no more restriction. In Italy they still have, so you have people in Italy, when I go back they say to me, you are so lucky that you are in Switzerland, because then COVID is over. And you see, but we need to learn to deal with this uncertainty by finding a common ground, and moreover, by having a network between the nation, networking, institutional networking, programming. Instead, very often, each organization gives their own thing. It's a reproduction of an overabundance of information, and maybe you do not address the need of people. So I would, yes, learning from past, learning from other cases, and interconnecting within a nation.
Perhaps then I would ask, because you had mentioned before that you think that a time without misinformation is unrealistic. That time will always be there. And unfortunately, we know people in our own lives, our friends, family, partners, who have been taken under by this misinformation. What, in your opinion, what can we do to support these people? Because of course they're being very well taken in by this information, and sometimes this has really negative consequences, of course, for their own health and for their lives and the decisions that they make. Can you touch on that, maybe, on what we can do? Because now we've had the privilege of listening to this fantastic lecture, and we are informed, but there are so many others who will not even give such a lecture a chance because they are so convinced by the misinformation that they are.
Yeah, I mean, it's I don't have the definitive answer on this. What I say, what I always say to people, you need some trust. You need to trust the people who knows more about something, but the people who really know something. Because the problem is, I always said, I don't want to say the institution cannot make mistake, but overall, I mean, come on, as institution in country which invest in knowledge, they have a view which then we may disagree on some aspect, but you need to have trust. But the real problem, and this is where I do not have an answer, is a lot of position come from ideology. They come from ideology. They don't come from any rational. I mean, I'm not saying that ideology is irrational, but I say that when you think that all institutions are fake, whatever you say to this person, whatever you say, it won't be taken. I have a channel on Instagram, and when I was doing this video about some aspect of this, I mean, there are people who just insult you because they say, you scientists, me working with WHO, being responsible of the pandemic, these are the things. And in front of that, the only chance is that you explain clearly. So institution, the effort that they have to make is to explain. For example, a lot of people say WHO informed late about the pandemic. Actually, WHO informed before the protocol. But you need to know how WHO works. And you need to know how is it when you can say there is the risk of a pandemic. And if people do not know this, if nobody tells them, then the chances to convince these people are zero.
Thank you very much. I see another question from Diana.
Yes, I have a question. Thank you, Sara. It's very interesting, your work. I'm a bit amazed how much you have done in this last year, because it's very complicated. My question is related to following the trust question, because I think trust is the main key, but it's, at least from my perspective, it's almost impossible to deal with that. However, in the pandemic and nowadays, it's more problematic, the infodemics, because it goes so fast, and it's because social media. Don't you think a way to manage this is start controlling there? Because these big companies, there are not so many, there are few that handle, I think, more than 90% of the social media. governments need to impose some kind of regulation so they just don't distribute fake news, because it's very difficult to ask people to understand science. Maybe that's a failure of scientists, but that would take a really long time. But instead, it's possible just to control those.
Thank you. Absolutely important point. So some things have been made because, for example, Instagram and Facebook, in front of real fake news, they put a label. The problem is that a lot of this information is not just black or white, because the ability of a lot of information is that is embedded in narrative, which put together true and fake content. So any algorithm would be very, very difficult to spread, to detach a lot of things. Second thing is, although again, Facebook, especially Facebook, was very much on board on that, how do you limit those people who are not intentionally spreading? Because it would mean to block. How do you block? Because remember when Trump was blocked by Twitter, from Twitter, was a big issue. Was a big issue. Because again, is then you can say, yeah, but in that case was an institutional role and think like that. But for even company of social media would not give the impression that they restrict freedom of speech. Mm-hmm. So the criteria are not there. It's an area where we need to build proper guideline to identify what exactly. And what they do, they limit this is COVID information. Be careful. Instagram, for example, in Switzerland, they put this is COVID information, check BAG. They link immediately to BAG. There was already something. But of course, if someone want to believe in false information, they would not. They would think this is real, and they would think that the BAG try to give wrong information, because this is the thing. But it's a major topic.
No, thank you, Sara.
We still have just a few final minutes, so if anyone else has a question, please use this time to unmute yourself or otherwise to write in the chat. If people are thinking of questions whilst they're doing that, then perhaps I can ask one that's on my mind, and that is, I'm just curious, because obviously you have a lot of experience in this and you've been working in this, you see a lot of it, and I was wondering then for you, what has been the most surprising thing for you, the most surprising kind of piece of misinformation out there that has really left you mind blown, where you've seen that many people have followed along? I mean, perhaps it's not just one thing, but I don't know, because I guess that certain people might already, especially if you're in the field of misinformation, you might already be able to identify where these things could come up. But has something particularly surprised you?
Yes, health professionals spreading disinformation. That for me was really something. I can cite an example because it was everywhere on all the media, and WHO had to say something. Milan, San Raffaele, major hospital, Dr. Zangrillo, the doctor of Berlusconi, in summer 2020, went on TV and said to the Italian, COVID is clinically dead. That claim went everywhere. A lot of Italians believe that it's the doctor of Berlusconi, so he knows what he's talking about. And a lot of Italians stopped believing that COVID was still a problem. Summer 2020. For me, this was the most, because I was expecting an institutional reaction of this, and did not arrive. So that's why I say this is something that institutions really carefully need to consider.
Thank you very much for sharing that experience and of course for your very interesting talk. I don't see any more questions in the chat, and we are actually, unfortunately, anyway, coming to the very end of our time. But I would just wish to thank you once again, Professor Rubinelli, for sharing all your expertise with us and the insights that we received from this. And I hope that at least for those watching, that we understood finally the importance of institutions and of ourselves in this role of managing infodemics. So thank you very, very much for your time.
Thank you. Thank you very much.
Thank you.
Thank you. Thank you.
With that being said, then I just finish finally to let people know what is coming up next week. At the same time, same day of the week, we have monitoring COVID, combining clinical and wastewater surveillance, and this will be presented by Dr. Jana Huisman, who's a researcher at the Department of Environmental System Science at ETH Zurich. It will again be via Zoom. I really hope that all of you can join us. Again, I always close with this page. This is just an invitation once again to scan the QR code if you didn't do so in the beginning, and take a look at the Sustainable Health quiz. Thank you so much for your attention, and thank you again to Professor Rubinelli. I wish you all a very nice evening and hope to see you again next week. Thank you all, and goodbye.